Tube additives. Except for the red topped glass tube, which has no additive, all tubes contain at least one additive. Additives include anticoagulants, clot activators, thicotropic gel to separate components, preservatives, and inhibitors of various cellular reactions to maintain the integrity of the specimen. Any tube containing an additive must be inverted and mixed immediately after removal from the needle adapter into the evacuated tube. Turning the tube over and then back equals one inversion. Anticoagulants. They prevent clotting. And of course, clotting is coagulation. So anticoagulants prevent coagulation. So it prevents clotting. Sodium or potassium ethylene-diametitracetic acid, which is EDTA, binds calcium, which will inhibit coagulation of the blood. Other additives that bind calcium are sodium citrate, potassium oxalate, and sodium polyanethyl sulfonate, which is SPS. Next is heparin inhibits clotting. Heparin inhibits clotting by preventing the conversion of prothrombin to thrombin. The phlebotomist must make sure to fill the tube correctly so that there is the correct ratio of blood to anticoagulant. The choice of anticoagulant used is determined by the test done. EDTA preserves blood cell integrity, prevents platelet clumping, but interferes with coagulation studies. Sodium citrate used for coagulation studies. SPS used for blood cultures because it inhibits certain immune system components that could destroy blood-borne bacteria. SPS will neutralize any antibiotic the patient may be taking. Heparin. Heparin preferred for plasma chemistry and blood gas determination. Potassium oxalate, used for glucose determination, may be combined with sodium fluoride, which inhibits glycolysis, which is a cellular reaction to harvest energy from glucose. Next is clot activators. These promote clotting. So it promotes coagulation, which is clotting. Thrombin increases clotting and is used for stat serum chemistry or if the patient is on anticoagulants. Substances such as glass or silica promote clotting by providing more surface area for platelet activation. Clot activators may be adhered to the side of the tube. The phlebotomist should invert the tube at least 5 times to make sure the drawn sample has come in contact with the activator. Thixotropic gel. It inert synthetic substance with a density in between that of cells and blood serum or plasma. As a result, when a patient's blood is drawn and centrifuged, the thixotropic gel turns to liquid and moves between the lower cell layer and the upper serum or plasma layer. Next is gel hardens. So the gel hardens after standing and forms a barrier between the two layers, which allow for easy separation. The phlebotomist knows the number of inversions depends on the tube type, but most needed 5 to 8 gentle slow inversions.